Good afternoon, everyone. Today's session is going to be really helpful and it's led by Dr. Shilpi from Apollo Cradle and Children's Hospital. She is going to talk about is uterus removal necessary in all cases of abnormal uterine bleeding. So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Yeah, thank you. Good afternoon. I'm Dr. Shilpi Sachdev, consultant, obstetrician, and gynecologist at Apollo Cradle, Motinagar. A very warm welcome to all of you. So, today the topic of my discussion is uterus removal surgery required in all cases of abnormal uterine bleeding? So, before we go further, you must be knowing that what is normal uterine bleeding or normal cycles. So, a normal cycle is one where the length of the menstrual cycle lasts from 21 days to 35 days. So, this is calculated from first day of last menstrual period. So, if your cycle is shorter or longer, then that is called abnormal. We will go in detail. And the number of days also should not exceed more than 7 days, and there is no passage of clots. That is considered as normal periods or normal uterine bleeding. Now anything which is not in this a normal thing is abnormal. So if a female is suffering from heavy periods which last for more than 7 days, or she is soaking pad every 1 to 2 hours, or if she is using tampons more than one per day, that is called abnormal uterine bleeding. Then, other than this, if the cycle length is shorter than 21 days or it is longer than 35 days, again calculating from first day of the last menstrual period, then that is also called as abnormal uterine bleeding. Now, what else is abnormal? Is any bleeding which occurs in the mid cycle. Like if she has stopped with her periods and after few days she starts bleeding again, can be a like a normal flow, or it can be just spotting. So that is considered as abnormal. Or she has any bleeding which is after intercourse, that is also abnormal uterine bleeding. Other than this, if she has attained menopause and after 1 year of stopping her periods, she starts bleeding again in the form of proper periods, heavy periods, or spotting, that is also considered as abnormal uterine bleeding. So these are the common things. If she is having delayed cycles that I told you, it's more than 35 days, that is also considered as abnormal. And if the cycle length also every month is varying from more than 9 to 10 days, like sometimes it is coming, 6 8 days prior, and the other months it is coming uh, 6 8 days later, so then that is also considered as abnormal uterine bleeding. So, in all these cases, a female should meet her gynecologist and get herself assessed for any problem. Now, the bleeding can be acute or it can be chronic, abnormal uterine bleeding. So, acute is that there was no history prior to this abnormal bleeding, and suddenly she starts bleeding profusely, heavily, and so much to the extent that it leads to giddiness or blackout or palpitations, chest pain, then that is called acute abnormal uterine bleeding. And chronic is if these symptoms are occurring for more than 6 months, 6 months or more. Now, the commonest causes of these abnormal uterine bleeding, I would just take over, and then I'll tell you that in which cases the uterus removal surgeries can be avoided. Now, the commonest age group in which it occurs is once the female starts her period, that is menarche. She starts her period at 10 years, 11 years, 12 years. So, that time, as the brain is not very much developed to send the hormone uh, influences, then there is fluctuation. The ovulation is erratic. Sometimes the ovulation or the egg formation is happening, sometimes it is not happening. So in that case, the periods can be erratic, or it can be delayed or frequent. And the other common age group in which this problem happens is perimenopause, that is after 45 years of age. That also the ovulation is erratic. So sometimes the ovulation is happening, and sometimes it is not happening. So the lining of the uterus keeps on increasing and thickened, and then it sheds. It sheds heavily, it is delayed, or it is early. So that kind of thing, presentation. Now the causes, we will come to causes. So the causes are any benign growths in the uterus, so like polyps or fibroids. So these are the protrusions. Polyps are the protrusions which comes from inside the cavity of the uterus, protrudes into the uterine cavity, and common cause of heavy period or intermenstrual bleeding or postcoital bleeding. Now, these polyps can arise from the lining of the uterus. They can also arise from the mouth of the uterus, which is called cervix. So these are usually benign, but yes, they have to be dealt with. I mean, these needs to be removed surgically, but yes, uterus removal surgery can be avoided. So what we do in these cases is we go through a camera through the vagina. There won't be any cut on the abdomen. That is called hysteroscopy. So through the vagina, through the mouth of the uterus, we entered into the uterine cavity. We visualize this polyp, and then we remove it. That is called polypectomy. And we take a sample from the lining of the uterus also. Sometimes there are fibroids. Fibroids are also non-cancerous growths of the muscle mass of the uterus. Now, these fibroids can arise from the muscle mass, but they can be, just localized in the muscle mass, or they can project into the endometrial cavity or the uterine cavity, or they are on the external surface of the uterus. So those which are on the external surface of the uterus usually does not disturb the menstrual cycle. And the fibroids which are in the muscle mass, they're large enough that they protrude into the lining of the uterus, or they are just localized submucous in the projecting into the lining of the uterus. Usually they disturb the menstrual cycle and cause heavy periods or intermenstrual bleeding. Now these can also be dealt with removal, not requiring uterus removal. Only the fibroid removal can be done. So, how to approach them? Again, I told you that through hysteroscope, through a camera, we enter in through the vagina into the cervix, that is the mouth of the uterus. We entered in the uterine cavity, and through an instrument called a septoscope, these fibroids which are projecting into the uterine cavity can easily be removed. Now, the fibroids which are more towards the external surface or the main muscle mass can also be taken out through laparoscopy. So, laparoscopy is a procedure where small 3 to 4 cuts, just a centimeter or half a centimeter cuts, are made in the abdomen, and through a camera we visualize and then remove the fibroids through those small cuts. So it's a uterus sparing surgery. We can spare the uterus unless until the female wishes to get her uterus removed. If she has completed her family, if she is beyond say 40-45 years of age, and she doesn't want that, I mean, that in future there is any risk of these fibroids coming up again, then even the uterus can be removed. But the here we are talking about the uterus sparing surgery. So the fibroids can only be dealt with, though we have certain medications also nowadays which can reduce or limit the size of the fibroids. But yes, they can limit till the time the female is taking the medicine. So once the medication is stopped, the fibroids again grow up. So this is, and the polyps which I talked about, can be in the mouth of the uterus also, which can produce uh, the intermenstrual or the postcoital bleeding. So these polyps also needs to be surgically removed. Now, there is some hormonal issue, like in cases where there is polycystic ovarian disease or PCOD, where the female is not ovulating every month, the lining becomes thick and it causes heavy periods. So, in that case, also we can, visualize through hysteroscope, and we can do a DNC, which is can be therapeutic DNC, and we can insert a Mirena or a hormone releasing device which controls the heavy flow or shrinks the lining of the uterus, and it works for nearly 5 years. Now, this problem can also be dealt medically to some extent, but yes, then the hormones need to be taken, and they have to be taken daily, on daily basis. There are certain injections also which are used for limited period, like GnRH analogs, but they should not be used for more than a year, 6 months to 1 year. So now, other than this, there are conditions in which the uterus removal surgery is mandatory, and that is cancer. So if there is a cancer of lining of uterus, that is endometrial or uterine cancer, then the uterus needs to be removed along with removal of ovaries and tubes and other things that needs to be seen. Now, if there is cancer of cervix, that is cancer of mouth of uterus, then also the uterus removal surgery is mandatory. But if it's a precancerous lesion, so precancerous lesion is that in it is the cancer is localized to the superficial lining of the mouth of uterus, and it has not invaded inside. So if that thing is confirmed with cervical biopsy, then only the cone biopsy, or we say the LEAP, large loop excision of transformation zone, can be done, and the uterus removal surgery can be spared. Now, if there are large ovarian cysts, or uh, there is endometriosis, then the uterus removal surgery can be spared. So, the endometriosis also causes heavy or irregular periods. Now, what is endometriosis? That is the lining of the uterus, which is called endometrium, grows in the ovaries, and it forms large chocolate cysts. Now, as this can cause problems, I told you that this can be dealt with medicines. We have medicines, or with injections, or with uterus sparing surgery, in which we do laparoscopic ovarian cystectomy. So, again, through a camera in the abdomen with very small cuts around 0.5 to 1 centimeter, 3 to 4 cuts, these ovarian cysts only can be removed, and the ovaries can be spared, the uterus can be spared. Now, there is a condition called adenomyosis. So, this is also one condition which causes heavy, irregular, and painful periods. So, adenomyosis is the lining of the uterus grows in the muscle mass of the uterus, and at the time of periods, when it swells up, it causes pain. Sometimes it causes infertility also, so the female is not able to conceive. So in these cases, other than medical management, that is the tablets or injections, we can do uterus sparing surgery, in which only the adenomyoma is removed through laparoscopy or through open surgery. So, this is the uterus sparing surgery. Again, the adenomyosis is sometimes associated with endometriosis, and both of these can be dealt with. The Mirena, or a hormone releasing device, which is inserted in the cavity of the uterus, it is a progesterone releasing device. This to certain extent takes care of adenomyosis, endometrial hyperplasia, polyps. The polyps do not grow up again, and um, endometriosis. So, endometriosis, adenomyosis, endometrial hyperplasias, polyp formations, these can be dealt up with uterus removal surgeries with Mirena insertion. So, the mandatory thing in which the uterus has to be removed, I told you, is cancer, or cancer of mouth of uterus, or cancer of tubes, cancer of ovaries, in which the uterus needs to be removed. Or if a female has endometriosis, adenomyosis, or large fibroids, and she has completed her family, and she doesn't want her fertility or her periods to continue, so then the uterus can be removed. Then, I mean, it all depends on the patient, that what she wants. So these are the main causes, and there are other causes also, like PID, that is pelvic inflammatory disease, in which we can deal that with antibiotics, and if there is some chronic pus formation, we can drain that laparoscopically. uh, Sometimes the abnormal uterine bleeding is also because of hormone pills, which the female pops in nowadays as postcoital or emergency contraceptive pills. So this also causes irregular heavy period, because the dosage of the emergency contraceptive pill is very high. So, this is a request that these emergency contraceptive pills should not be popping like that. A regular contraceptive in the form of a pill or a IUCD is suggested. And so, if this is happening because of these pills, so that should be avoided. Now, there sometimes the heavy periods occur because of IUCD, that is intrauterine contraceptive device, which is like copper T inserted in the uterine cavity. In these cases, this copper T should be removed, and some other method of contraception should be followed by the female, either in forms of pills, or if she's comfortable with IUCD contraceptive only, then the option of Mirena, or a hormone releasing device, which I just discussed, um, can be given to her. This reduces the amount of flow to a good extent. So commonly these are the things. But if the normal uterine bleeding is happening in a very young girl at the time of her starting of periods, then a bleeding disorder should be ruled out. Whether this bleeding problem is there in the family, or she has some genetic component to it, which is suggested by her history that she gives, that if she has any injury or any wound anywhere in the body, then the bleeding tendency is more, and it is difficult to stop that bleeding. So in that case, other than complete blood count, her bleeding profile is to be checked, and then that has to be dealt accordingly. So these are the common things I had to tell you, in which the uterus removal surgery can be spared. Thank you. Any questions? I can't see any questions in the chat box. Okay, so there are no questions as of now. So we just call it a day. Thank you so much for the patient hearing. Thank you.